To support resolution number 54. While we have concerns that it does not go far enough, because brothers and sisters, if the Affordable Care Act is not fixed and it destroys the health and welfare funds that we have all fought for and stand for, then I believe it needs to be repealed. We don't want it repealed, we want it fixed, fixed, fixed. And I commend Rich Trump and the AFL-CIO for leading that charge. Unintended consequences for all the proud men and women that we represent to be collateral damage in the healthcare fight in this country. We ask the Congress of the United States of America to do the right thing, for the proud men and women that we represent. There isn't a union member in our movement that has ever been a drag on the healthcare system. Unintended consequences in a law. It needs to be changed, it needs to be fixed, and it needs to be fixed now, brothers and sisters.
2 words, single payer. We need to have a policy. Brother Gerard keeps reminding us that we talk about, Americans will do the right thing after they've tried everything else. But we've tried a system where, if you're rich enough or you're healthy enough or maybe you're lucky enough to work for the right employer, you get insurance. But we've seen co-pays, out-of-pocket expenses, holes in these plans, and now we reach a point where if you've got a morally responsible plan, there's actually something in the Affordable Care Act that's going to tax those plans. Well, those plans are morally responsible because we fought for those plans. We fought to make them responsible. We fought for everything that was in them. Those plans shouldn't be taxed. But if we had, finally, a system, single payer, where we didn't have to worry about insurance.
Health care and give them good health care. Not some passive thing that a politician can put on his resume as he retires with our money, our insurance. It's all about them. This is the one opportunity at a convention that we as labor leaders can represent our people the way we're supposed to. I ask you to stand up and ask for action on this and let the government know, who's ever in office, we're not going to take it anymore. We're going to fight for our workers. Every one of our members is important to us, and we want resolution. And Rich, I thank you for all you've done here. I know how I do work. I know it's tough, but I'm going to tell you something. We have to win this one.
The Seafarers International Union of North America, and I rise in support of this resolution. The seafarers, we live a very strange life. We're not just a bunch of drunks like a lot of the movies cover while they're laboring. Commercial health care insurance companies have never wanted to insure us because of the way we work, so we had to build our own system, and it's something that our members and us deserve, and it comes.
Obamacare. I think it's great that millions upon millions of Americans are going to get health care for the very first time. We should not lose sight of that, as Terry O'Sullivan said. I like the fact that Obamacare does what, frankly, our union plans have done for a long time, no pre-existing conditions, etc. And we should not lose sight of that. But I fully endorse and think what has been said about action needs to happen in order to fix Obamacare. Because it is a remarkable situation that the earliest and the biggest supporters of the president were right here in this hall. And we have stood and fought for his agenda, the Democratic agenda, rightfully so. We're the biggest proponents of real health care reform. And despite all that, when we hear that they can't do it because it's the law, I want to remind you, when they waived the employer mandate for a year, that's against the law, and they did it. When they made the special deal for the Capitol Hill staff people, that was against the law. When they made the deal that somehow or another the contraceptive part of the ACA had to be changed because of the pressure of the Catholic Church. That was against the law. So they have conveniently said what's in the law and what's outside the law and what they can do at their convenience. And that's not surprising because they have responded to people and to organizations that fight for their beliefs. So I think what's been said before about this resolution is absolutely true. It's one thing to pass a resolution, it's a second thing to fight for it, and it's not just the administration. We have got to talk to U.S. senators.
Of the California Nurses Association and the National Nurses Organizing Committee. I also sit on the board of directors for the California Nurses Association. And I stand here before you today with an ask for all the people of this country. When healthcare access can be available and a guarantee to every person. The American Affordable Care Act does not solve the healthcare crisis facing all the people, not just working people, but all the people. I want to give a few facts because I have to hurry. The ACA provides for 4 tiers of insurance coverage. One can purchase a bronze, silver, gold, or platinum healthcare insurance policy, which covers respectively 60, 70, 80, 90% of medical costs. Each level has an ascending cost for purchasing an insurance policy, with the co-payments and deductibles following suit, and are much higher for the lower tiers of insurance coverage. This will certainly not improve access to health care, which is what is the issue. Not that health care insurance is purchased, but do you have access? Nurses see this problem daily as we work to save those who have waited too long due to cost in seeking health care. They simply cannot afford the co-payments and the deductibles required. ACA will also not remove the issue of healthcare benefits from collective bargaining, and we continue to fight that battle. Close to 70% of the U.S. population want a single-payer healthcare program, Medicare for all system. The labor movement must walk this walk if we are ever to achieve healthcare access for all. We must not be afraid to stand tall for healthcare access for all. New and improved expanded Medicare for all. A single standard of care, a single payer system of privately provided, government administrated health care, just as every other...
I'm going to have to ask you to wrap up.
Thank you. Every other industrial nation provides its citizen. I had some more facts, but I will exclude them, and I just want to finish by saying Resolution 54 is problematic as it allows our healthcare to be held hostage to the greedy, highly profitable health insurance industry. Healthcare is a human right and has a market-based approach. They have no place in healthcare. For these reasons, the nurses stand in opposition to Resolution 54 and ask that those that are part of the single-payer majority stand tall with the nurses. Thank you, sisters and brothers.
Thank you, sister. The Executive Council recommends that you vote for the resolution. All those in favor of the resolution signify by saying aye. Aye. Those opposed, no. The ayes clearly have it.